Good morning, everybody. So this is a brief presentation on the history of New Hampshire's regional system. And it sort of gives us an idea as to what was before the current system was established. But to orient ourselves to the current system, as many of you know, we have a regional system that serves people with developmental disabilities and acquired brain disorders. And the system has been around for a while, over 35 years. It was established in 1981. And one of the unique aspects of the system is that it operates exclusively a community-based service system. And New Hampshire was the first state in the nation to close its institution back in 1991. So we are one of few states that operates support system for people with disabilities without an institution. And that's sort of a unique aspect of our system. As you know, there are 10 area agencies, and each area agency is directed by its own board of directors, and it has contracts. The agencies have contracts with the state, and they pretty much are the coordinating entity within each region, and they have a variety of responsibilities. In addition to the area agencies, we are fortunate to have a lot of subcontract agencies that serve people with disabilities in New Hampshire. So here's the map of New Hampshire, and you see the 10 regions, and the Moore Center is in Region 7. Although it's kind of small geographically, as you know, it's the agency that serves the largest number of people. So you may ask, what was there for people with disabilities before the system was established back in 1981? Unfortunately, there wasn't much. Back in the old days, New Hampshire county farms were the only places where people can receive some supports. There are two pictures of the county farms, one in Strafford County, the other one in Cheshire. And county farms were the only places where people could receive help. Whether they were elderly or whether they were disabled, whether they were just children, everybody went to county farms to receive some sort of support. I'm going to focus on a 10-year period. It's going back a little bit to 1893, because between 1893 and 1903, there were some significant developments in New Hampshire. First, a tragedy on February 9, 1893. At the Strafford County farm, there was a devastating fire, and 40 out of 44 people perished. And part of the reason for that was that there were iron bars in the windows and the doors were locked because people were seen as presenting danger to others. And so as a result, the folks could not be saved. So as a result of the fire, the public at large and the legislature began to show interest in the conditions of the county farms. And the legislature set up a board to oversee the county farms. And after some review, the board recommended that there be some significant changes in the conditions of the county farms. And along with that, beginning of the 20th century, Women's Club of New Hampshire petitioned the legislature on behalf of the children with intellectual disabilities. So 1903, it turned out to be a critical year because the state opened its first institution for people with intellectual disabilities. Using the terminology of that day, they called it New Hampshire School for the Feeble-Minded. And so that institution was now the place where people could go to get some help. Along with that, the legislature passed a law assigning to the state the responsibility of paying for services at New Hampshire Hospital, which was intended to serve people with mental illness. Although the hospital had opened in 1842, anyone who went to the hospital had to either pay for themselves, or if they were poor, the county ended up paying. The state was not paying, so in 1903, the state took on that responsibility. And at the time, the New Hampshire Hospital was called New Hampshire Asylum for the Insane. So here are some pictures of the state school where people with intellectual disabilities went. It sort of gives you an idea of the kind of condition that existed at the institution. Your eyes are not deceiving you. There are no seat covers on those toilets. And how did people spend their day at the institution? Well, this is a typical picture of what happened. Imagine yourself or a family member living in this type of environment. And imagine you are 6 years old and they take you away from your family and place you in an institution with a bunch of other strangers. So these pictures sort of depict the typical environments in institutions. Those of us who worked in institutions could tell you that they are very challenging places, both for people who reside there as well as the staff members who work there. You have a large number of people trying to live together, in close quarters, and you have lack of privacy, inadequate staffing typically, and people not having anything meaningful to do, basically. And over time, the demand for services increased, especially during World War II, and more families were looking for help. As a result, more people were placed at the institution, and the bad conditions actually became worse. So during this presentation, I'm going to introduce you to a number of people who had an impact on the disability field. And our first person that we want to look at is Burton Blatt, who was a national leader in special education and who was quite familiar with the conditions that existed in institutions. He wanted to really let the public at large know what existed in institutions. So he had a photographer friend. So Burton Blatt and his photographer friend visited 4 institutions in the eastern United States and secretly took pictures of the conditions. And as a result, they were able to publish a book called Christmas in Purgatory. This is back in 1966. And with the publication of that book, we, the general public, began to get an idea as to how people with disabilities were living in institutions. So here are some pictures from Christmas in Purgatory. Again, imagine yourselves being there. As you could see here, the conditions were worse than the ones that I showed you earlier from the Laconia State School in New Hampshire. This is really an inhumane environment. So we may wonder, how could this happen? How could we justify creating places like this for people who are disabled, who are vulnerable? How could we justify institutions and their conditions? Well, surprisingly, some well-educated people with their ideas and with their publications actually contributed to the whole development of institutions. Here's a British civil servant called Charles Trevelyan. He is one of the ones who was identified as creating labels to assign to people with disabilities: feeble-mindedness, imbecility, idiocy. And admittedly, this is back in the 19th century, quite a long time ago. And here's another British fellow, Sir Francis Galton, who was a brilliant man who was actually accomplished in many fields. And he happened to be half cousin of Charles Darwin, and he was quite interested in eugenics. And eugenics is a sort of belief in improving the genetic quality of human population. So the idea is, through promotion of higher reproduction of people with desired traits, you sort of improve the quality of the society. Of course, there is the flip side of negative eugenics, and that is if people happen to have less desired traits, then they don't really belong in the society. The critical question is, who gets to decide what's desired and what's not? Here's an American psychologist by the name of Henry Goddard. He is the one who introduced the term moron as a diagnostic term in psychology. Okay? Mind you, we're not talking about a schoolyard bully here. This is a well-educated, apparently well-meaning person who's introducing and using these terms as a psychologist. So when we look at these three accomplished men, they sort of tell us how people saw people with disabilities. They didn't think that they were fully human. They really didn't belong in the society. At best, they were a burden to the society. And the conclusion is not far that one would think, well, if they're not fully human, then they should not be with us. They should be put somewhere else. So there we have the institutions to house the people with disabilities. And their impact is not just in terms of the institutions. There is a famous Supreme Court case from 1927, Buck versus Bell. Carrie Buck was an 18-year-old young woman with intellectual disability living in the state of Virginia. And the state decided that she needed to be sterilized. And through some miracle, Carrie Buck got a lawyer, and her case went all the way to the United States Supreme Court. And Supreme Court decided that the state was justified in forcing Carrie Buck to have sterilized. And the ruling was that it was a justified intervention for the protection and health of the state. And the last thing we could note from this era is that reports indicate that in Nazi Germany, about 300,000 people with disabilities were killed before Nazi Holocaust started. So this is sort of the indirect impact of how people were seen by professionals that led to the creation of institutions and some developments in our society. So this is really the biggest lesson of our history, and that is how we perceive people, how we label people, influence how we treat people, how we support people. And it's kind of surprising that even the perspectives and ideas of well-educated people sort of agreed with that perception of people that said, if you're an individual with a disability, you're not really one of us. Well, that was the bad news. The good news is that there were some folks who said, well, wait a minute, there's something wrong with this whole view of individuals with disabilities. And especially families sort of started looking around and seeing what was going on, and they started speaking up. So here's a person who sort of led the charge. Interestingly, both Wolfensberger is a person who was born in Germany. And as I was telling you earlier, where close to 300,000 people were killed, people with disabilities. And he ran away from Nazi Germany, came to the United States. And when he came here, he brought an idea that he had been exposed to in Europe, and that was the idea of normalization. Well, what does that mean? Basically, it's simply saying we need to accept people with disabilities as human beings and give them the same opportunity that we all have. Just normal way of seeing people, normal way of treating people. And as you can imagine, he was quite against the idea of sending people to institutions. And he believed that people really belonged in their own communities. And he pointed out that individuals with disabilities can contribute to their communities. Here's another person, John O'Brien. Some of you may have heard of him. He was an advocate for a concept called person-centered planning and person-centered provision, service provision. What does that mean? Well, instead of assuming that all people with disabilities need the same thing, need the same supports, you sort of look at each individual as an individual and try to find out what their needs are, what their skills are, what their capacities are, and build services around those. And listening to the people is something that John O'Brien and other advocates really focused on. And the other thing they sort of emphasized was to sort of working with family members to support the individual. And they emphasized the really changing the services, not changing the individual, but changing the services so that the individual could benefit from the supports that they are receiving. Here's a person from New Hampshire, not a professional, is Frieda Smith, is a parent from Salem, New Hampshire. when she had her daughter Janet, she was advised to put her at the institution. After a while, Frieda ended up placing Janet at the state school, but every time she went there, she could not really imagine how any person should be living in the environment that she was looking at. Ultimately, she talked to some other parents, and they, as a group, decided to take the state to court. And lo and behold, they won. And as a result, the federal court ordered the state to improve the conditions at the state school. And one of the important outcomes of that decision was that it led to the development of the regional system back in 1981. So here are some parents creating a very significant change in our system. It's one thing to have families advocate. It's another thing to have officials from the state or private agencies to respond to those advocacy statements from the families. And Donald Shumway is the person who was in charge of the State Division of Mental Health and Developmental Services back in the 1980s, and he's the prime architect of the regional system that we have. Although he responded to the court order and improved the conditions at the state school, he nevertheless recognized that institutions were no places for people with disabilities, and he closed it back in 1991. And his impact also created better opportunities for people with mental illness, as he closed the old New Hampshire hospital and created the today's acute psychiatric services that we have in Concord, New Hampshire. Here's a family from Iowa. Julianne Mark Beckett had a daughter, Katie Beckett, who at 4 months contracted viral encephalitis. As a result, she was paralyzed and unable to swallow and breathe. So she ended up in a hospital at 4 months. For the next 2.5 years, she stayed there because she could not come home. And the only other option for her was a nursing home with older adults. So her family persisted in looking for a better option, meaning that they wanted to bring her home and they wanted to support her at home. But because of their income, they could not qualify for Medicaid. So they knocked on every door. They eventually ended up appealing to the White House, and the Reagan administration decided that it was really right to support this family along with many others who had similar needs. So back in the 1980s, there was a new eligibility category created called Katie Beckett. Actually, families now refer to Katie Beckett services, and so as a result of the efforts of this family, millions of children and families have benefited from the supports that the government is able to provide. And what's so interesting is that as the home-based care helped this family, the federal government actually saved money, because putting her in a nursing home would have cost more money than what they ended up spending in home-based services. Here's another person from Iowa, former Senator Tom Harkin. He's the one who authored the Americans with Disabilities Act, ADA. Back in 1980, this legislation passed to provide protection against discrimination based on disability. Until that time, people couldn't get into regular buildings because they were in a wheelchair. And there was no law to create a way of helping people. So when this law was passed, it really opened a world for people with disabilities. And since it's been a while, we sort of take this granted, but at the time it was not easy to sort of get this law passed. As you could see, people had to demonstrate. It's called the Capitol Crawl because people who were in wheelchairs demonstrated at the Capitol to make the point that there was a strong need for this law. So as you could see, due to the efforts of a lot of people, especially families, things have gotten better. And we should point out that things have gotten better because we changed. Not that people with disabilities change. We as a society are seeing people differently and we are doing things differently. So that brings us to the three changes that we need to highlight here as demonstrated by our history. One is how we see people have changed. Remember the views from 19th and 20th century where people were thinking that individuals with disabilities were not fully human. So we've gone through a tremendous transformation in terms of how we perceive people. So that shift in our attitude has led to progressive laws and regulations and allocation of public funds to provide services to people. But most of all, lessening of a stigma helps people to live in their own community, go to school, go to work, and become contributing members of their local community. It's interesting when we see things differently, we do things differently, and as a result, now our services that we offer are different. We sort of try to follow a person-centered orientation to sort of customize and individualize our services. And we have learned to listen to people, to listen to their families, to find out what they are really truly asking for when they ask for help. And the supports that we provide are intended to obviously to help people to be a part of their community and do valuable things like volunteering and having employment. Lastly, we have empowered people through regulations and laws. And in the old days, all of the decisions used to be made by professionals. Now individuals and families are given the opportunity to make decisions regarding their services. And as a result, people are able to shape their own supports rather than simply having professionals decide when they're going to be served, how they're going to be served, where they're going to be served. And as a result, it has become a collaborative effort. Professionals and individuals and families now share power, if you will, and work in collaboration to support people. So as a result of these changes, I can now show you some pictures of people that you may actually know. These are folks from New Hampshire, and they are being served through our system, and these are pictures from their employment sites. you see how different these pictures are from the ones that I showed you earlier. Imagine these folks living back in 1960s or 50s. They would have been in the pictures that I showed you from the institutions. Because of the dramatic changes, they are able to lead a totally different life. So, as Edmund Burke said, we need to know our history so we don't repeat some of the mistakes that we might have carried out. So this is the reason why when people are hired by agencies as professionals, they are given the opportunity to get to know the history, to appreciate the progress that we have made, and to get a full perspective of how we are supposed to serve people with disabilities. So, to summarize the journey, once we began to see people as one of us, it was quite clear that they needed to be served in the community. And we started providing all kinds of supports to have people have a regular life and meaningful life in their own community. And as I shared with you, the advocacy of the families has been a significant driving force. The families and their advocacy really shaped the system. One of the smartest things that New Hampshire has done is to learn to listen to individuals and families. Their feedback, their ideas have really made our system one of the better service systems in the nation. And these days, many local communities are welcoming, and they support people with disabilities, and give them opportunities for work and volunteer. That is not to say that we don't have challenges. We still do, because some in the community are still hesitant to see people as fully community members, and they still see them as outsiders. Most of the individuals with disability are still unemployed. If you don't have unemployment, you don't have income. So many people suffer from poverty. And loneliness is still a big problem. And people may not have active and meaningful lives, and they need supports to be able to achieve those. So staff of area agencies and provider agencies play a very critical role, obviously, in supporting New Hampshire citizens with disabilities. And over the years, over the 40 years that I've been in this field, I've spoken to many staff and providers, and they have told me how rewarding it is to work with people with disabilities. And so we hope that as a new staff member, as a new board member, you recognize that you have a chance to influence people's lives and help them achieve meaningful lives and become contributing members of their local community. Any questions? We're good? All right. Oh, just come on.